The last thing Gerald did before he went to bed that night was tell his wife he felt fine. No chest pain, no dizziness, no warning he recognized. He just lay down the way he always did, flat on his back, hands folded across his chest, and went to sleep. By 2 in the morning he was gone, massive heart attack. And when his wife called me, she asked the question I have heard more times than I can count. She said, "Doctor, could we have known?" The honest answer, the one that still sits with me, is yes, there were signs, and one of them was exactly how he slept every single night. Most people believe that sleep is the safest part of their day. They think when the body is resting, the heart is resting too. But after 60, that assumption can be one of the most dangerous ones you carry into your bedroom every night. My name is Dr. Mae Jemison. I am a cardiologist, and I have spent more than 22 years working specifically with adults over 60 studying how the cardiovascular system changes with age and what happens to the heart during the hours most people think it is perfectly safe. What I am about to share with you is the kind of conversation I have with patients who have just received serious news. Stay with me. Before the 4 positions, I need you to understand what is happening in your body while you sleep. During the day, your cardiovascular system runs like a fully staffed hospital, systems backing up other systems, compensating for almost anything. At night, after 60, that same hospital runs on a skeleton crew, and in that reduced state, the position your body holds for 7 or 8 hours matters far more than most people realize. The American Heart Association has documented that cardiovascular events occur more frequently between midnight and 6 in the morning than at any other time of day. That is not coincidence. That is biology. The first position surprises people most because it is the most common among adults over 60. Sleeping completely flat on your back with no head elevation. Most patients tell me they were taught this was the correct position. They say, "Doctor, I read that back sleeping is best for the spine." And they are not entirely wrong about the spine. But here is what nobody told them about the heart. When you lie completely flat, your abdominal organs shift backward and upward, pressing against the diaphragm, the large muscle below your lungs that controls breathing. When the diaphragm is compressed, the lungs cannot fully expand, and blood oxygen drops during sleep. Not in a way you feel, but even a modest drop creates hypoxia, forcing the heart to push harder to deliver oxygen to your brain and organs. Think of a garden hose stepped on halfway down the yard. The water still flows, but you have to open the valve higher to get the same amount where it needs to go. Your heart is that valve. Night after night, that extra effort stiffens arteries and raises the risk of a nighttime cardiac event. The Mayo Clinic has documented that adults over 60 sleeping completely flat show measurably higher nocturnal blood pressure irregularity than those with even modest head elevation. The habit is simple. Tonight, add a second pillow, or fold your current one to create a 4 to 6 inch elevation. That one change takes pressure off the diaphragm, reduces reflux risk, and gives your heart an easier night. I have had patients make this adjustment and call 2 weeks later saying they slept better than they had in years. 1 pillow, that is all. We are only at position 1. Position 3 is the one that shocked even my most medically informed patients. Stay with me. The second position, sleeping on your stomach, carries risks that go beyond the heart, and most people have never heard them explained. Stomach sleepers tell me they have slept this way their whole lives and never had a problem. I believe them, but the issue is never what you feel. It is what is happening in your arteries while you feel nothing at all. When you sleep on your stomach, your neck is rotated to one side for the entire night. That sustained rotation compresses the carotid arteries, the major vessels supplying blood directly to your brain. After 60, when arterial walls have lost elasticity and narrowing has begun, a full night of neck rotation can meaningfully reduce cerebral blood flow and raise the risk of transient ischemic events, mini-strokes, that leave no clear trace except morning fog or a quiet feeling something was off. Think of a garden hose with a kink held in place for 8 hours every night. The hose at the bend weakens over time. The CDC has noted that sleep-related cardiovascular complications are significantly underreported because many happen quietly and people simply attribute the morning fatigue to getting older. If you are a lifetime stomach sleeper, start with 1 night a week on your left side. I will explain why the left side specifically in a moment. Use a body pillow to keep from rolling back. 1 night a week, build from there. I want to pause here and ask you something directly. Have you noticed mornings where you wake with an unexplained fog, or a mild headache you blamed on poor sleep, or a quiet feeling your body did not really rest? If that sounds familiar, go to the comments right now and write the word yes, just that word. I read every single comment. Before we get to position 3, I want to tell you about a patient. Her name was Dorothy, 67 years old, retired school teacher. She came in not for a heart concern, but because she kept waking at 2 or 3 in the morning with what she called a flutter in her chest, not pain. Just a flutter, like a fish turning over, and then it would pass. She had slept on her right side, right arm tucked under her body, for 40 years. When I monitored her overnight, we captured multiple episodes of atrial fibrillation in that exact position. Right side sleeping can compress the heart slightly against the chest wall, and in people with any electrical sensitivity, it can trigger arrhythmias. Dorothy had been living with intermittent atrial fibrillation for more than a year, undiagnosed, untreated, simply because no one had ever told her that how she slept could produce that flutter. We adjusted her position, started treatment, and at her 3-month follow-up she told me the flutter had not returned once. The American Heart Association estimates more than 9 million Americans have atrial fibrillation that is undiagnosed or undertreated, many of them experiencing nocturnal episodes dismissed as a bad night's sleep. If you have a family member over 60, a parent, a spouse, a sibling, what happened to Dorothy may apply directly to them. They may be waking with that same flutter and not telling anyone because they do not want to worry anyone, or simply because they do not know it matters. Save this video, send it to them when we are done. The third position, sleeping on the right side specifically, is one most people do not realize differs from the left. Your heart sits slightly left of center in your chest. When you lie on your right side, the heart hangs from its connecting tissues at a rotated angle, and the great vessels are under tension they were not designed to hold for hours. In people with stiff arteries, elevated blood pressure, or any degree of heart enlargement, all increasingly common after 60, this shift alters the heart's filling pattern and creates a subtle but real increase in workload that accumulates across the entire night. Think of a pump calibrated to push water when sitting level. Tilt it 15 degrees and it still works, but the seals on the bearing side wear down differently. Research from Johns Hopkins shows right-side sleeping consistently produces higher nocturnal blood pressure readings in adults with cardiovascular risk than left-side sleeping. The habit here is this: transition to your left side using a pillow between your knees for hip alignment and a firm pillow behind your back so you cannot roll backward unconsciously during the night. Give your body 10 to 14 nights to adjust. You are giving your heart a position where it sits more naturally, fills more efficiently, and does not spend the entire night compensating for unnatural pressure. Go to the comments right now and tell me, do you sleep on your back, your stomach, your right side, or your left side? Write it right there. I want to know. The fourth position is one almost nobody talks about, and it may be the most common among people who do not realize they are doing it. Sleeping in a recliner, on a sofa, or propped against a headboard at a steep angle. People end up here for real reasons: reflux, back pain, breathing difficulty lying flat. I understand every one of those, but here is what happens to the cardiovascular system during a full night in that position. When the body is at a steep angle, blood pools in the lower legs. The veins in the calves, already working against gravity to return blood to the heart, are now also compressed at the hip bend. After 60, venous tone, the natural elasticity that helps veins push blood back upward, is significantly reduced. Blood sitting in leg veins for hours can clot. The CDC reports that pulmonary embolism, when a clot travels from the leg to the lungs, causes or contributes to more than 100,000 deaths in the United States each year, with a significant portion linked to prolonged immobility in a fixed seated position. Think of a pump trying to draw water through a pipe with a sharp bend at its base. It has to fight that bend before the water can rise at all. That bend is the hip flexion angle of the recliner. Your heart is the pump fighting it every single night. If you are sleeping in a recliner because lying flat causes breathing difficulty, that breathing difficulty is itself a symptom. Difficulty lying flat can be an early sign of fluid accumulating in the lungs, called orthopnea, and is one of the warning signs of heart failure. Please have that conversation with your cardiologist this week. And if reflux is the reason, a proper bed wedge at 4 to 6 inches handles reflux without creating the circulatory problems of a recliner. Think of someone you know right now, a neighbor, a close friend, a family member over 60 who might be sleeping in one of these positions every night without knowing what it is doing to their heart. Send this to them when we are done. One tap, You could change something for them that they would never have changed on their own. I want to be honest with you for a moment, not as someone making a video but as a doctor. I have stood in a hospital at 3 in the morning tracing a patient's arrhythmia back to a sleep position. I have spoken with families who described the week before a cardiac event as completely normal. And when I asked about the recliner used for months because of back pain, or the flat sleeping after late dinners, there were always patterns. Events that looked like they came from nowhere almost never did. They came from a quiet accumulation of small stressors nobody thought to name. Most of the cardiac crises I have seen were not caused by bad luck. They were caused by missing information that existed, that was available, that the patient simply never had the chance to hear. You now have it. Here is your complete summary and action plan. Position 1. Flat on your back, compresses the diaphragm, drops blood oxygen, and increases reflux-triggered arrhythmia risk. Tonight, add 4 to 6 inches of head elevation. Position 2. On your stomach, compresses the chest, restricts carotid blood flow through sustained neck rotation, and quietly erodes cardiovascular reserve. Start transitioning to side sleeping 1 night a week. Position 3. On your right side, places the heart in a less efficient filling position and elevates nocturnal blood pressure. Transition to the left side using a knee pillow and a back pillow to hold the position through the night. Position 4. Steep recliner incline, pulls blood in the legs, raises clot risk, and forces the heart to overwork during the hours it should be at its lowest demand. If breathing difficulty is keeping you in the recliner, schedule a conversation with your cardiologist this week, not next month, this week. The patients who caught this in time, the ones sleeping safely and waking rested right now, did not have better genetics or better luck. They simply had better information. That is the only difference I have ever consistently found. And you now have that information. If this video gave you something real today, share it. Think of someone in your life right now. A husband, a wife, a parent, a close friend over 60 who has been dismissing morning fatigue or that occasional flutter as just getting older. Send this to them. That one tap may be the most protective thing you do for someone you love today. Tell me in the comments, which of these 4 positions do you currently sleep in? And which change are you going to make first? Start with 1. Give it 7 days. Tell me what you notice. I read every comment, every single one. Next week, I am going to show you 5 things that happen to your heart in the first 2 hours after you fall asleep. Specific physiological windows, the moments when the heart is most and least protected, and exactly what to do in those hours to reduce your nighttime cardiac risk. Hit subscribe and turn on the bell right now, because if today was useful, next week is going to matter even more. Before I go, everything I shared today is general medical information grounded in published cardiovascular research and my clinical experience. It does not replace your personal medical care. Before making any changes, especially if you have a known heart condition or are on cardiac medications, please speak with your own doctor. They know your history, they know your body. And that conversation, informed, direct, and unhurried, is exactly where the best outcomes begin. Take care of your heart tonight. It has been working for you every minute of your life. Give it the conditions it deserves.